Hi, my name is Amber Brady, and I'm 44 years old. I have a rare neurological disorder, a nerve disease called Subacute Combined Degeneration of the Spinal Cord and copper myelopathy. It's very progressive, and I now require 24-hour medical care, which has become extremely heartbreaking, upsetting, and a struggle that I can't put into words. I'm now bedridden and have a hydraulic lift, quote unquote Hoyer lift, that needs to be used in order to transport me from my bed to my chair. I'm working really hard to bring awareness of this disease because there's some factors that go into it that even doctors don't even think of at the time when it could have been caught early or quote unquote prevented. Please pardon me. I do not have control of my limbs due to the spasticity, which is so extreme at times that it breaks my bones and shifts them. My left side is the one that's mostly deformed or affected, as far as the bones moving and the toes have been broken and shifted. But the spasticity that occurs is not your ordinary spasm. I can get stuck in fetal position for an hour, and it's painful, and I can't move. If someone touches me in the wrong place, it could affect not only that part that they're touching me, but it can activate another part of my body. So I can get spasticity in my left leg, and if someone touches that, it will activate in my right arm, even my voice, because it affects my throat muscles, to my stomach muscles, diaphragm, and lungs. I was in the hospital with a collapsed lung and pneumonia and E. coli due to the fact of the inadequate and improper care I was receiving at home and in the hospital, and when I got discharged. And at the time of the shutdown, my Medicaid was denied, which then in turn, I lost my help with getting some of my supplies. And granted, not everything is covered by insurance either, even if you get it with the over-the-counter card. The pain that goes in is indescribable, unimaginable, and it's all due to copper deficiency in B vitamins, mostly B12. But they don't tell you about anemia and zinc that when you use your Fixodent, if you use it quite a bit like I did throughout the day, I didn't know it was affecting my copper absorption. Heck, I didn't even know copper was in the body until I was diagnosed last year. But I started having issues in 2020. And at the time, I was seeing a primary with my husband, who was not my husband at the time, but we thought it was maybe a bad case of fibromyalgia. And even my primary at the time thought it might have been lupus or some sort of autoimmune disorder. And he did A&A, but it was negative. And at the time he did blood work, he knew I was malnourished, but didn't tell me. Now in Ohio, we have a thing called My Chart, where you can look at your records and what the doctor's notes and all that, but I didn't know how to work it at the time. Didn't know how to log on to it or work it until 2023. And so he had some of the answers. I kept asking him to do an MRI. He wouldn't do it. He did a CAT scan of my brain, and because he was thinking MS. And I kept saying, no, refer me, just refer me. And unfortunately, he kept saying, no, let's try this first. Let's try that. And from 2021, I was walking normally, then my gait messed up and I was on a cane. Then from 21 to 23, a walker. But I could go back to a cane for some things, but a walker was most. Tool that was helpful at the time, but I was swelling. Shocks were in my hands and arms, and I couldn't stand long periods of time. I was swelling, and they had made it seem like I was making it up because of my PTSD from the trauma I experienced in my life. But we were married in 2022, my husband and I, and we went through our struggles, but it was mostly from me being sick. My bones didn't heal because of the calcium deficiency as well. I had a bone stimulator for my broken ankle that took 4 years to heal and 3 surgeries. And then, but let me backtrack. 2001, I had gastric bypass. 2006, I got pregnant with my daughter. So I was anemic at that point too. Nobody told me when you did the classes that it's just, it was more supplements than the B12 and that you're going to have to take omeprazole for the rest of your life and B12 shots. They didn't teach about any of the other supplements and nutrients needed to be monitored. So, anywho, this whole time, this subacute combined degeneration of the spinal cord and copper myelopathy is forming. And when I changed my primary in 2023, Dr. Atkins, this is how God works, did another ANA test, but this time she did it with something else, and I have to go back and look at my records. But it came back positive. So she referred me to rheumatology. But during this time, as I was waiting to see rheumatology, I woke up swollen to the point it looked like I had gout or elephantitis. And went to the urgent care. My husband carried me into the car and got me to urgent care. And they sent me to the ER. And then from there I found out I was deficient still in vitamin D, B12, and iron. And then he gave me a shot, an anti-inflammatory shot, and I got the swelling down, and he gave me some folic acid, B12, and iron pills, and which my primary carried on out. But 3 days later, the swelling came back. I was back in the ER. Now, I had not been in this ER more than 2 times since I've moved here in our new home. Because I'm not one for doctors. But I knew something was wrong. And so did they. They sent me to the kidney doctor. They sent me everywhere. But when I went the second time to this ER, because I went to the Cleveland Clinic first, but Metro Health, the second ER doctor I saw, he proceeded to explain to me that ER was not a primary care facility, and that if I take iron, I'll feel better. So I went to my primary, and she saw the tremors, and I told her about the shocks, and she knew it was neurological. So she referred me to neurology immediately as well, and got me a wheelchair or a shower chair. But these things got messed up, even the commode at the time, so I ended up having to buy it out of pocket because the insurance was getting changed. Okay, and so, anywho, when I got to neurology, he did a full MRI, which was extremely painful, and he did a lot of blood work and took 13 valves at one time, and another 4 or 5 the next, and then I get a call for me to come in on his lunch break, and he sent a ride for me. Showed my husband and I my MRI that it had ate my spine and my neck and damaged it so bad that my nerves are exposed. And it eating the sheath of my spine all the way down into the T4. I have to get that, I can't remember I have to look at my chart, but I'll get all that for you guys. But I have lesions and the spine is damaged all throughout. and that said there was no cure, no surgery, no medication that could fix the damage that has been done. But what he was trying to do is stabilize it. And now he sent me to the Spinal Institute at Metro Health in hopes that they'll help me get the things that I need, like the Hoyer lift, a better wheelchair, and no therapy and aids that I need. But that didn't happen. When the shutdown occurred, that prolonged my waiver application even more, and ended up denying it, especially since I was having issues with my husband, who was my immediate caregiver at the time. And now he's getting overwhelmed because at the same time his mother and me were sick, and we have since lost her in March of 2025, then his grandmother in August of 2025, and now there's a chance he could lose me. But it didn't make sense when he was jumping on me at the same time and I couldn't defend myself. And so, even though the care wasn't great at the hospital, it wasn't great at home either. And my home health aid agency turned him in. And when I was in the hospital, they arrested him because of what the agency had called APS, and which is Adult Protective Service, and called the police. Now, I had a plan, but I wasn't ready financially or medically as far as help to be in a position for him to be removed from the home. At least I thought, but God's plan is always the best plan. So even though I didn't think it was time, he did. So God is all knowing, all seeing, so he knew I was scared, but he knew most importantly that my husband needs help, and it's beyond anything I could give. So, anywho, people who have had gastric bypass, who have had gastric sleeve, any abdominal surgery, because I've had part of my intestines removed due to an attack, which caused a rupture in my intestines, where they had to be removed. So I was not getting the nutrients and supplements I needed, and I wasn't aware. And had the doctors listened to me and my symptoms, I probably wouldn't be in this situation. Probably would be mobile again, I probably wouldn't be in this situation. And I would like to bring awareness to anybody who is in a situation of domestic violence or any type of mental, physical, emotional abuse, because I've been there in all ways. And it's scary when you're alone and you have to rely on other people to help you. I have lost my dignity. I have had infection after infection due to uncleanliness. People not caring. But if you're out there and you're in a situation similar to mine, pray. God hears you. He will send a message. He will send someone to you. Because all the people who have helped me on my GoFundMe to get the supplies I needed, or help me pay my bills, because my husband left me in a situation where I could lose my home, which I helped get through Habitat and I helped build before I got sick. He will answer your prayers. Don't give up. He'll collect your tears. And he will send help. And he will guard you with angels. But pray. And be an advocate for yourself the best way you can. But nobody should be alone. Nobody should go through this stuff alone. And I have my friend Jasmine, who has been coming here and making sure I've eaten and stuff. And she has lost some of her income trying to care for me. And she's the single mother of an autistic child. So regardless of how your help comes, know that God will use anyone, even if it comes through someone you least expect it. And I least expected it through the people on GoFundMe, the donators. And I least expected it from my friend Jasmine, who I met getting a GoPuff delivery. But God is the one that makes all this possible. Please, if you have Fixodent and you've had weight loss surgery, take your nutrients, especially copper, an hour or two after or before you use your Fixodent. Even Pedialyte has zinc in it. Okay? And that will prevent you from absorbing copper. Now, this is years. I was hurting myself with and didn't know it. It's one thing for you to sacrifice for your family, but when you don't know you're hurting yourself, and you end up in a position like this where you can't care for your family anymore. It can be detrimental to you and them. So I'm pleading with anyone out there who needs help or knowledge of domestic violence, help, or having to live a healthier life and know the right things to do or to look out for, please ask your doctor. Be on them. Look it up, even if it's on Google. Get your supplements, vegetables, vitamins, any way you can, because if you're no good, you can't be there for your children, especially if you've had a ruined gastric bypass. And it wasn't for kicks that I got it. My doctor told me at the time I wouldn't see my 2-year-old son graduate high school. I had hypothyroidism, so while it gave me 20 years, it's killing me now because my copper level was a 6, my B12 and iron were so low, I had to get iron infusions, IV infusions. That still didn't help, and now I have to see anemia clinic. And I have a hard time getting to my appointments because I don't have the help or the care aid that I need because I can't afford them. And a facility my doctor doesn't think is the best, which we just came from Metro Health, and it wasn't, the rehabilitation center wasn't the best care at all. And she discharged me with inadequate care, and she knew it. And even through my domestic violence, my home health agency knew they were dropping me when I was in the hospital because they sent out a letter, which I received when I got out of the hospital due to the domestic violence. Now, I did everything asked of me, got the protection order, made a statement. Like, even though I wasn't ready, they blew up my life. It just leave me high and dry. Which I'm trying to look into for law purposes because it's not right. No one should ever have to be in this situation at all. So anyway, stay tuned for another video. I'd like to do a live one so people can be able to ask questions. Leave comments if there's anything you want to know about my disease and what I'm experiencing. I'll be happy to answer. But a life on a urinal and on bed chucks, which are bed pads and diapers, is not fun. It's embarrassing. And trying to fight the spasms to have a bowel movement is like giving birth. I feel like my body has an eternal corset on the inside of my stomach, chest, diaphragm, lungs, and then tourniquets around my legs, feet, toes, ankles, knees, hips, and then needles with fire. And on my privates, it feels like road burn. And this is every day. This is my everyday life. I wouldn't wish on anybody. So if your ANA comes back negative and you have been malnourished or deficient in some nutrients, you get your doctor to look into this, because it's not the first thing that comes to mind when they do a CBC. Thank you again for listening. And God bless you all for all that you are doing or are trying to do. And thank you for listening. Bring awareness, because you don't want to end up in this situation, especially when it can be prevented. God bless you all.